I'm Dr. Leighann Forbes. I'm the Vice President of our U.S. Medical Affairs for Neuroscience at Johnson & Johnson. My role focuses on bringing forward scientific evidence that helps clinicians make informed treatment decisions and improve outcomes for patients living with serious mental health conditions like treatment-resistant depression and schizophrenia. So I'm excited to talk about the data presented at ASCP on perspectives of nurse practitioners and physician associates on presenting long-acting injectables to adults with schizophrenia, a Delphi panel study. So to give some background, mental health conditions impact approximately 1 billion people worldwide and is projected to be the #1 cause of disability worldwide by 2030, which is coming sooner than we realize. And of those patients, schizophrenia is a complex, chronic, progressive condition that affects about 2.8 million adults living in the US. Yet, this is a condition that remains significantly undertreated. And in fact, approximately 40% of adults living with schizophrenia are not receiving adequate care. Schizophrenia is very serious and can affect every aspect of a person's life. And relapse is one of the biggest challenges that a patient faces. Each episode can disrupt stability in their life, and it can lead to long-term decline. And in fact, the average patient suffering from schizophrenia can experience as many as 9 relapses in as little as 6 years. So how can patients be better served? I think really the unmet need here is that despite clinical benefits that long-acting injectables have shown in studies, fewer than 20% of patients are receiving long-acting injectables or LAI treatments. And this really highlights a gap in care. So this study gathered insights from a panel of nurse practitioners and PAs, physician associates, who were very familiar with and used long-acting injectables. And we did this in order to obtain expert consensus and really better understand how to improve the conversation about the treatment options for schizophrenia and really maybe examine potential barriers to successful LAI initiation. Some of the key findings from the panelists were to introduce LAI treatment options earlier in the treatment journey with patients. So to really normalize the conversation and use LAIs as more of a standard treatment option versus something that you'd save for a last resort. Another key finding from the panelists was to really center the discussion around patient preference and goal. So emphasize the flexibility and the reduced treatment burden that can happen relative to, say, taking an everyday oral therapy. Importantly, as well, is to use patient-friendly, very clear language. I mean, no one wants to be in a discussion where you don't understand terms and meanings. So to make a language clear and accessible to all and to be able to provide ongoing educational resources and to help address misperceptions will really help the patient and their caregiver team build confidence in a long-acting injectable plan. And really leverage a team-based care. Having the entire treatment team in the conversation with shared decision-making is really a key finding from this study. So it's important to assess all practitioners in the treatment journey because not only are psychiatrists seeing patients, but NPs and PAs are actually spending even more time in the discussion on therapeutic options for patients. So it was really important to gather that expert consensus to determine from these questions, what's important in terms of that conversation, and what do you think could potentially be important advantages to discuss, as well as barriers to appropriate care for a patient. So I think it's improving how providers can engage with their patients can really help increase adoption of effective therapies and treatment options because ultimately you want to lead to reduced relapse. You know, as I mentioned before, the average patient can experience 9 relapses within 6 years. And we know that studies have shown that relapses have actually been tied to an increase in all-cause mortality. So being able to decrease the likelihood of a relapse in patients with schizophrenia is a critical goal in long-term management for patients. So I think if you remember one thing, it's this. In schizophrenia, stability is everything. And improving how we can communicate and how we can engage with patients on important treatment options like long-acting injectables is a key step in towards achieving that.